Good morning. I'm Dr. Philip Blumscher at the Ozark Chiropractic Clinic, and I want to welcome you to our email newsletter this week. I'm going to change it up a little bit. Been talking about a lot of functional medicine and things, and I want to go back to a total different switch I did some time back. It's some frequently asked questions, because we have patients asking similar questions, and I'm sure a lot of you have the same question, or you'd like to know what it is, the answer is, so I want to go over that. So without further ado, let's get started. One of the main questions I get all the time is somebody, can you help me? And things. That's a more common question than you think. And what I always tell patients is we always offer to do a consultation at no charge. If we can help you, I'll tell you. If I think there's something going on that I can't help, then we're going to refer you off to the right person. So either way, and it doesn't cost anything for a consultation. If we think we can help you, then we go forward and do an exam and x-rays, and that would be a charge for there. So that's that first question. I always have questions like, what's the noise? When we're adjusting your back, you hear the popping sound. What's the noise coming from? Well, that term is called cavitation. The joint capsule is surrounding the joint, and the pressure inside that joint capsule is less than the pressure outside. So when we adjust the bone and move it quickly, you get the release of the gas in the joint, and it's called cavitation. So that's where the noise comes from, okay? Now, another one you always hear, is it bad to pop my knuckles, or will it cause arthritis in my joints, okay? No, it's not gonna. That's a good old wives' tale. Matter of fact, by adjusting the spine, we're keeping the joint mobile, and that's gonna help prevent it from getting worse. Oftentimes, when a joint has been in subluxation or off alignment for so long, that's where your arthritic changes will come from. So it's very important that we help get motion back into that joint. That's going to increase your mobility, your flexibility. It's going to decrease your pain and help you have more range. So that's good there. Another question I often hear is, will it hurt? Okay, fair enough. And things, I always tell folks, there's one of three things that are going to happen after your first adjustment. Sometimes you're going to feel the best you felt in some time. That's great. Sometimes you're going to have some new aches or pains. It's a changing. It's kind of like exercising the first time. Or sometimes you may feel no difference at all. Now, we always do our best to make sure that you feel good, that you have as little pain as possible. And I always will adapt to where we're at. If somebody's in a great deal of pain, we're going to go into a little easier, or somebody who's not. So it's always a case by case, because we do want to make it as comfortable as we can and make it a pleasant experience for you. Thanks. Another question we get is, how long will it take? Again, this is a question, it varies from everybody. Our exams help determine that, our x-rays, how long you've had the problems, the severity of them. There's other complicating factors in there. So all those things all play a role too. Our goal is to help you get better as quick as we can, but we also don't want the problems coming back, because there's a big difference in getting relief from pain and getting a problem corrected or fixed as much as we can. Pain is just a symptom. It comes and goes. We want it to be gone, and we want you to be able to get out there and to function and to do the things that are important to you, because our underlying goal is to help you get your quality of life back. It's to help you get out there and fish, to hunt, to play with your grandkids, to work in the garden, to do activities, be able to sleep, to perform at your job, because that's what starts to miss when you've had chronic problems, or you're having a problem that's affecting you and affecting how you function. So that's my main goal, is helping you get that back in your life there too. Now, I hope that answers some questions. I want to keep going on and things. I hope you have any questions. Please don't ever hesitate to send an email to the office through Facebook or through the website, or call us. Always is open there at 479-667-5053. Contact us on the website, like us on our Facebook page. We always appreciate that. If you have any feedback, I'd always love to hear from people there. But I want to thank you for your time. Have a great day, and we look forward to seeing you next time. Thank you very much.